Welcome to another exciting episode of Muse Capital's podcast series on the future of how we care. Today, we're continuing our journey into the future of women's health and focusing on one of the most profound and transformative phases a woman can experience: pregnancy, birth, and postpartum. Joining us today is one of our phenomenal founders, Melissa Hanna, CEO of Mahmee, spelt Mahmee, a company revolutionising maternal and infant healthcare by offering personalised, continuous care, both virtually and in person, through their app and services during this critical time. Melissa and her team are not newcomers to this space, having built Mahmee over the last 10 years, closing important gaps in care, ensuring that those experiencing pregnancy and postpartum receive the support they need. We're excited to get into how Mahmee is shaping the future of maternal and infant health.
Hi, Melissa.
Hi.
Welcome to the podcast.
Thank you. I'm so happy to be here.
And we're so proud to have invested in your company.
Yes, Muse is a long-standing partner of the company, really one of the earliest investors.
And Rachel has an intimate experience with Mahmee.
I do. It's got to be over 5 years ago now. So I was pregnant with my first, and I remember being almost 9 months pregnant and Melissa coming into our offices and telling us all about these incredible services that Mahmee was providing. And I remember having that meeting and very ignorantly saying to Asya, well, surely if you have really good healthcare, you'll get all of these things as part of it. And so how very wrong I was. Talk about learning the hard way. The long story short is I ended up having my son at one of the best hospitals in Los Angeles. And after that, I remember having my son and saying to the nurse, I really want to see a lactation consultant. I don't know how to breastfeed. And I remember them saying, we don't do that anymore, but the nurse will tell you. And I was like, what? So I'm exhausted. And then the nurse comes in and says, just do this. And I'm like, didn't remember any of it. And then the next morning, another nurse comes in and says, just do this. Something completely different to what the other person said. And I was literally just rolled out of the hospital. And I struggled. I really, really struggled. And I honestly didn't know what I was doing. And I'm like, hang on a minute. I've got to call my OB or I've got to call my pediatrician. And they're like, oh, well, pediatricians don't really help. You need to go to your OB. And I'm like, huh? So then I go to my OB and they're like, oh, no, go see a lactation consultant. And I'm like, wait, what? I go and see a lactation consultant and it's okay, but then I can't follow up because she's so busy. I get transferred to another pediatrician's office and I explain what's happening to me. And they say, check this company out. And sure enough, it was Mahmee. I had somehow, and I didn't know this until I'd interacted with Mahmee, I'd given myself a breast infection called mastitis. And somehow nobody really cared. And then when I called Mahmee, I remember being connected to Megan in Mahmee's team, and she was a lifesaver. I literally met her, she sat with me, she's like, wow, you have a serious breast infection, you're this far away from it becoming very, very serious, and you need to do this. And I remember talking to her how did I do this? And we figured out together that it's because first of all, I'd pumped too early. You were supposed to wait 3 weeks. Didn't know that. The second part was I'd been using the wrong size flange on my breast pump. Again, who knew that there's different size flanges on a breast pump for the size of your nipple? And I was absolutely blown away. And I remember just saying to Megan, thank you so much. This is incredible. And then immediately hopping on Slack, I think a few weeks after giving birth, and saying to my team, we have to invest in Mahmee. We have to hunt down Melissa. This company just changed my life and my son's.
So much for maternity leave. I mean, literally,
yes.
We were like, can you please stop working?
And I remember writing Melissa a long email, sharing my terrible experience at the hospital and my incredible experience with Mahmee, and was like, I have to be part of this journey. And so here we are today.
Here we are.
Just over 5 years later. So just wanted to say I have a very personal experience of the service and how crucially important it is. And so, first of all, thank you. And I mean, why don't we start there?
Yeah. I would love, first of all, thank you for taking care of my work wife and best friend. I remember that moment vividly. And we literally did try to tell her to stop working. She's like, we've got to invest. We've got to invest. This is life changing. So
It was a really action-packed time.
we're so grateful. And so just kicking it off, tell us a little bit about what got you to start Mahmee, how it came about, what your journey has been up until now.
Well, the origin of Mahmee is really the collection of stories just like Rachel's. The work of maternal child health care is not for the faint of heart. The folks who work in this field are deeply passionate and very committed to serving expecting and new parents and in their newborns and infants. And it's not an easy field to work in. I learned this through exposure to the field through my own mom, who is my co-founder and business partner and inspiration for this company.
Linda Hanna.
Yes, the great Linda Hanna. She's well known across the field and throughout mom circles across LA. And so I grew up with someone who was always well regarded and renowned in the field, really had a very successful career building maternal and child health programs for hospitals and health systems and doctors' offices and outpatient care programs. And she just really worked in all these different settings, all with the same vision of ensuring that mothers and babies got the care that they need. And that was always her field. It was not what I was doing. I actually was pursuing, at that time, a legal career working with startups. And I was in law school on this track to become a lawyer for other companies. But living at home during that time, trying to save money while I was in grad school, getting a JD and an MBA concurrently. And I was in this really intense academic program, and I would go home and then hear my mom's stories about caring for patients just like Rachel. And all of the stories were really different. I mean, the breadth of experiences that new and expecting parents have it's just incalculable, across society. Having a child, preparing to welcome a child into your home, becoming a parent, there's a lot of different ways that happens. And there are a lot of different versions of that story that are possible. And I saw that in my mom's work and in her colleagues' work, and I wanted to be a part of it. And that was really what drew me in as I started to learn about the disparities in care and that not everyone has a great outcome in maternal infant health care. And in fact, the United States has some of the worst maternal health outcomes compared with other wealthy nations spending similar amounts to take care of moms and babies. I learned that we actually spend the most of all of these countries and we have the worst results. And that to me seemed very, very wrong. And I put on my MBA hat at that point and said, okay, there's something that's not checking out about this financially. How do we spend the most and get the least in return? We're investing so heavily as a country in taking care of mothers and babies. We should have the best outcomes. Everyone should have a great experience giving birth in this country. And I put on my legal hat and said, okay, what about the policies that are affecting this? Why aren't there better policies and better institutions for supporting this very vulnerable time in people's lives and making sure that everyone has the best chance of success for themselves and for their baby?
And that was how many years ago now?
That was 10 years ago. I really didn't think it was going to put me onto this path. People don't get into this for fun or for kicks. The folks who work in maternal and child health are, they'll do it for free. They'll do it because it's what their heart is calling them to do. And I thought, well, that seems pretty true from everything I've seen. And, being my mother's daughter, that's certainly the description I'd give of her in this field. And I thought, well, if that's the case, then why is it such a messed up industry? Everyone really wants to do right. Everyone really wants this to be a great moment in people's lives, preparing for, welcoming a child, bringing a family together, building a family. Why does this feel like such a challenging time in people's lives? And I couldn't shake that question, and I wanted to figure out how to make it better.
So on that, Why don't you explain to the listeners, like, what is Mahmee? What does it do? Talk us through it.
Mahmee provides wraparound prenatal and postpartum support. We simplify the experience of getting care that stays with you, is ongoing support, is comprehensive support from conception through baby's first birthday. So that entire episode, that entire window of time through pregnancy and into postpartum until 1 year postpartum. During that time, we provide a set of services that complement the primary care, the obstetric care, the pediatric care that you and your baby would typically experience. So we are supporting the rest of the care model. We're not your doctors, we work alongside your doctors. We instead are the nurses, the doulas, the lactation consultants, the mental health providers, the nutritionists, and care coordinators that help all of those different pieces of your maternity care journey fit together and ensure that you are heard throughout your experience, that you're advocated for, that your needs are being met. And ultimately, we're trying to reduce the risk that something bad happens during this episode of care. We can't avoid all risk. It's a pretty powerful experience carrying a child, going through labor and delivery, um, experiencing postpartum, and caring for an infant. And all of these aspects are inextricably tied together. There's a symbiotic relationship between parent and child, and it's physical, it's mental, it's emotional. There's a lot of things that can go awry. The thing that we work to do is to provide comprehensive support and guidance and ensure that no one falls through the cracks of the system, that everyone gets the care they need when they need it.
So how does it work exactly? So having a child in a few months. So what would a mother do?
For folks that are expecting a new baby, a lot of families find out about Mahmee through a friend, a family member, through their OBGYN, or even through their hospital where they're planning to deliver. And in any of these cases, families are able to enroll through our site. We have a website, we have iOS and Android apps, and also just simply call. Something that's a little bit different about us is that even though we are a tech-enabled healthcare company, we're first and foremost just a healthcare company. We want to be accessible to people. We want you to be able to pick up the phone and call us and get a hold of a real person who can talk you through what's going on and help create a plan for you and for your family. So folks come to us in all different ways and in all different stages of their maternity journey.
Do you have examples of mothers that have fallen through these cracks in the healthcare system and how Mahmee has been able to help them?
I do. I have a lot of examples. This is something that it never gets old, hearing people's stories, hearing the reasons why people come to Mahmee. Sometimes it's because they've had a negative experience in a previous pregnancy or in another chapter of their life, and they have good reason to be concerned and or distrusting of the healthcare system. They want to make sure that they have an ally, they have an advocate with them throughout the journey, and they want that from Mahmee. We've seen all sorts of stories. What we do that makes the difference in people's care is we're proactively engaging, we're checking in. We want to make sure that we are accessible to them. I'm thinking of a story just recently of a mother who was about a week and a half postpartum, had expressed some concerns to her doctor that she wasn't feeling well. She was dizzy, just feeling really exhausted, physically unable to get out of bed. The delivery itself had gone well. There's really no reason to believe that there was a complication. And she was told, "You're probably fine. You just have to rest it off. You just had a baby. Of course you're tired." She had had an epidural, so there can be some after effects from that can include headaches. And so that seemed like a common symptom, something not really to worry about. But in fact, her body was telling her something else wasn't right. And she went in to urgent care. They checked her blood pressure. It was high. They gave her some medication to help lower it and checked her vitals otherwise and said, You're good. We're going to send you home." Well, this same mother already had Mahmee on her care team. We had been working with her from pregnancy, and she was utilizing our full services for doula support, registered nursing care, lactation support. She'd gotten the whole package actually through her insurance company. So In this case, she went into the app and she messaged her doula. And she felt that was the best person she could go to share, her anxieties, that someone was just not paying attention to her in this story. And she said, I know they sent me home and they said I'm fine, but I still don't feel right. What else can I do? Well, the Mahmee model is team-based. Our staff are working collectively to support families. And this is really when you see the power of it. Her doula actually flagged her profile in the platform for one of the nurses on her team to take a look and say, can you just check her medical record and have a conversation with her and see if there's anything more to this story that we're missing? And a nurse called her, talked with her on the phone, did some triage by phone, basically asking a few additional questions to figure out what these symptoms were, and said, I'm kind of concerned about you, especially since they did give you some medication at the hospital and said your blood pressure's high. I think you need to go back in and this time demand that they do more tests and that they admit you because you may need some overnight care. The nurse also went one step further, and this is the hallmark of what we're able to do with Mahmee. The nurse actually called the hospital and said, we're sending a patient in. This is really what advocacy looks like. The mom said, I don't know if they're going to accept me. They already sent me home. They're going to say I'm crazy. I mean, how many times have we, all of us as women, felt that way or had a friend feel that way, where you just think, if I say something again, what are they going to think about me? If I raise the alarm, raise my hand again. And so she was really hesitant, but the nurse provided that comfort and confidence and said, I want you to go back in. I'm going to let them know that you're coming in and that they need to pay closer attention. Well, this patient ended up getting admitted for 2 days at the hospital. That's how ill she actually was. And they said that we helped save her life because her blood pressure ended up being so high when she got there that they said, oh, there's no way we can let you go home. You are at risk of a cardiac event or stroke. Now, of course, in this story, there's a lot of different people that are involved. The patient's care team, the hospital team, the Mahmee team. It only takes one person to say, you know what, I'm going to fight for you. I'm going to make sure you're getting a little extra attention. And it's powerful because it demonstrates that one person can make a difference. But also, there are other things that happen behind the scenes that we had to help with that don't necessarily get the headlines in this story, because this person also had a new baby. So if she's getting readmitted to the hospital, that means someone else is caring for the baby. Well, our team also coordinated with her family to make sure that she had support at home, make sure her partner felt prepared to care for a newborn while mom's in the hospital. And there's also a need for mental health support during this time because this is a really frightening experience. But this is just one example of what happens when we're supporting patients that might have otherwise fallen through the cracks. And there are countless stories like this.
That's incredible. So, I mean, really, truly life-changing care. So how does somebody pay for the service and how does it work?
So our services can be paid for out of pocket. They are typically covered by insurance, and we do have partnerships with large insurance companies, health systems, and hospitals. And so a good portion of our population of patients are actually getting some or all of their care paid for through one of these enterprise partnerships. But we do have patients that sign up all the time and pay out of pocket for the services they need when they need them. They often can get those reimbursed by sending in a super bill or a receipt for care directly to their insurance companies.
And where are you available?
We are available nationwide with virtual support across all of our service lines. So that includes doula care, lactation support, remote patient monitoring for high-risk patients, mental health care, and nutrition support. We also have in-person services available across the state of California where we provide in-home support, and we have Mahmee clinics. These services are best provided in a comprehensive package. My goal with building this company was to eliminate the burden that so many families face in having to pick and choose what kind of care they think they're going to need when they're going to need it. And also having to decide what's worth paying for during this really important time in your life where you should have every support available to you, especially because we don't know what your story is going to be until it unfolds. So my vision was always to offer a value-based package, something that makes it cost-effective for families to get all of the services that wraparound pregnancy and postpartum care should include for one transparent price. So that was the first product that we built at Mahmee, was the membership to include all of these services. And that's available now. It's the thing that many enterprise organizations pay for their patients. They are able to purchase it on behalf of their populations. And people can sign up on their own and purchase that. And that includes comprehensive prenatal and postpartum doula support, lactation care and education, personalized guidance on infant feeding as you're transitioning from the early stages of feeding your newborn all the way through that first year of life. It includes the nutrition coaching and also the mental health support and ongoing classes, support groups, and all other types of educational guidance that is relevant across that episode. So that's sort of the full package. But we do have families that say, I really just need lactation care, or I have a really particular issue that I'm trying to solve for, and I really want some mental health coaching around that to help me prepare, for example, for returning to work. And I need to figure out how to sort of rearrange my sleep schedule and get myself feeling good and empowered and ready to return into a work environment and leave my baby in the care of someone else. That can be an extremely stressful point in time in this episode. And we have families that just reach out for that. We have families that reach out because they received a scary diagnosis during pregnancy and they've now been classified as high risk. And they want to make sure that they've got really active attention and oversight over their care. We know that you only see your OBGYN every few weeks. So what happens in between? We think of those in-between moments as the domain of Mahmee. That's really where we shine, is supporting you during that time.
So just on accessing your services to the everyday consumer, for example, they hear these stories and they're like, oh, this sounds amazing. I want this for myself, or I want this for a friend or a family member that's, about to have a child. How do they access Mahmee and how much does it cost?
Consumers can sign up for Mahmee and get the Mahmee membership for $30 a month. It's a very accessible price to have comprehensive access to all of the people on our team. And that includes unlimited messaging with the staff. So asking any questions that are coming up for you, getting advice on anything that may be happening in your particular story versus, just sort of going to the internet for general advice. This really allows you to have a personalized care experience. And included with that membership for $30 a month is all of our online education, our classes, our support groups, our coaching sessions with mental health providers and nutritionists, and the personalized app experience where your care plan lives and is continually evolving with you during this period of time. So that's a great place to start. And then if there's a need for additional care, whether those are doula services or lactation care or other complex needs, patients that are experiencing high risk pregnancies or postpartum periods of time, we have additional services available that you can pay for as you go. So you can access, for example, doula care for pregnancy, for labor and delivery, for postpartum. And we sell those as packages. So you get either strictly virtual care or if you need in-person support, we have that available as well. So doulas will come to your home. They'll meet you at the hospital for labor and delivery. We provide full spectrum doula support. We also provide lactation appointments, and those are especially impactful in those first few weeks and months postpartum. A lot of families actually come to us during pregnancy and say that they want prenatal lactation education. So we do those appointments as well to help people prepare for their game plan for infant feeding after the baby arrives. In all these cases, these appointments and these packages can be paid for out of pocket, but they're often covered by insurance. Most of our patients are actually getting some or all of their care covered by insurance. So that makes it very accessible for a lot of families. And if people call in or they go to our site, they can get more information on what's right for them, and we'll often help them figure out what's going to be the best way for them to engage with the services and make the most of what we offer when they need it.
What a great way to start with just $30 a month to just get on the app and start figuring out what you need.
I can talk to that because I've actually used Mahmee now for both children. So for my son, who's now 5, and my daughter, who is 1, totally different experiences. And it's really interesting because you think you remember everything from the first and you absolutely don't. And, one child could be completely different. I had a very tough time with my son with breastfeeding at the beginning, which Mahmee helped me with. And then I remember very vividly saying, I'm not going through this again with my daughter. And so I remember calling Mahmee in advance, kind of getting a plan of how I was going to do things differently. I wasn't going to pump till 3 weeks, thanks to the Mummy team. I knew exactly what flange to use on my pump this time. But also there were still total differences between the kids, and I needed them just as much. Every baby is different, and, Melissa and Linda and the team were incredible with that. And, I did Mummy membership where I was texting back and forth with the team, which was great through the app. But then I also did do, a couple of lactation appointments. And it was definitely the kind of full care that I needed. And that's just one example, but there's many more.
The way you describe the experience of working with Linda is something that is representative of what we're trying to do, which is to set families up for success and to build that confidence that you need to have, that you deserve to have, that you will be better for in this time by being able to execute against a plan that makes sense for you.
We at Muse are certainly seeing a lot of companies out there now claiming to solve for these issues, especially around AI and this concept that AI is going to change everything. Can you explain to our listeners how Mummy's different from other startups in the space?
I have a lot of opinions about the companies that are coming up in the space, and I am overall very optimistic about where the field is heading. And I think we need a lot more people doing a lot more work in this space for us to see the kinds of results that are possible for new and expecting parents. That said, one of the things that makes Mahmee really different from a lot of the solutions that are in the market now and starting to come into the market is that we're a healthcare company first and foremost. We call ourselves a tech-enabled healthcare company because we use a lot of technology to power the experience, to reach our patients, to stay in touch with them, to train our staff, to support the entire care model, as we call it. But ultimately, we're delivering a service. And I think that has been something that a lot of tech companies have wrestled with and in some cases sort of steered clear of, because it is the most complicated part of mother-baby care, is actually taking care of the mother and the baby. There are a lot of really great apps for tracking aspects of the journey. There are a lot of new solutions out there that are AI driven, that are making it possible for more rapid identification of risk or rapid response to patients' needs using AI. Where we find technology to be most powerful in our care model is in fostering the connection between patient and provider, basically superpowering our staff. One of the things that I am most concerned about right now in the industry, as we see the proliferation of AI-oriented and AI-focused solutions in maternal and infant health, is that these models have to be built with and trained on data that may not necessarily be representative of the population at large and may not necessarily tell your story. And that creates a substantial risk of perpetuating the bias that already exists in this healthcare system in the United States. We know that Black and Indigenous mothers have higher rates of risk for maternal morbidity and mortality, the risk of getting injured during or shortly after childbirth, or dying during or shortly after childbirth. And we know that families across the board are experiencing maternal infant care in very different ways depending on where they live in the United States. And so what we want to do is ensure that the right solution, the right care is available to each family when they need it, and in a way that's going to be most impactful to them in that moment, whether that's virtual or in-person support. And we want to use technology to do that. We want to use technology to reach families and get out there. Well, we all collectively as an industry have to be very mindful about the risk of building technology using data that is not telling the whole story of what families are going through in this country. And because many of the companies that are working in this space now are actually quite new compared with Mahmee, they don't have a lot of real world data to work with yet. And what ends up happening is that many of these models are trained on synthetic data or data that has been manipulated and structured in a way to achieve this result of building a viable AI model. But again, that's where the risk of perpetuating the things we think we know about what mothers need, the things we think we know about where risk exists in the population becomes a great concern. And with Mahmee, what we've done is we've built our technology based on the real world data that we are maintaining, that we are nurturing through our care model. Basically, we take care of patients first, and then we have the real world stories to build better models on and to build
This
better
isn't
solutions on.
new data. You've had this for 10 years.
Exactly. We've seen tens of thousands of families through this model, through this platform. And when I say model, I mean our approach to care through an approach that is comprehensive, is team oriented, because our doulas and our lactation consultants, our nurses, and the rest of the team, they're working together. So they're sharing information, they're cross training, they're helping each other get better at their work. And they are, through all of that, informing the way the technology supports them in their work. So we're constantly refining the way that the Mahmee platform works in order to ensure that providers are able to operate at the top of their game and that patients feel that they are getting personalized support, not some sort of one size fits all generic advice or generic response. And that comes from having many, many stories of patients to work from. And our population is quite different from a lot of the populations of other apps and other companies today. 80% of our patients identify as non-white. We're working with families across the socioeconomic spectrum. About half of our population are Medicaid beneficiaries. So we really see a very broad spectrum in terms of care. 30% of our patients identify as Black. And so when you compare Mahmee's population with, for example, the national averages and or other companies that are serving new mothers and babies, we really stand apart in that way. And our data tells a different story. And we can then use it in a way to create a care model that is more equitable and is more personalized to unique perspectives and unique lived experiences.
And I think just from our perspective, when talking to health systems, when talking to insurers, there is a real reality about maternal and infant care. And that is there has to be an in-person element, right? And we know that Mahmee is in-person and virtual care, which is why you've had success like in these areas. Maybe you want to talk to that a little bit more.
The question is, how do you show up for people when this episode of care that we call maternal and infant health is happening in the real world for people? People are still giving birth in person, and we have to find ways to be there for them physically and emotionally as well, and recognize that you can't get all of the solutions you need from an app, but that can be a starting point to your care experience. And so that's how we've approached this. Our model is hybrid. We provide in-person and online support. We have a workforce of doulas and lactation consultants that provide care at Mahmee clinics and also in the home setting. It's really important to have both because in major metropolitan markets, we can have locations, our Mahmee clinics, where people are able to come in. They can come into the office, they can get an appointment. We offer those, on the hour throughout the day, 7 days a week. And so there's a lot of accessibility there. There's a lot of people that are, same day appointments. They're saying, I just need someone to check me out right now. I need to have a conversation with someone and I want to do it in person. I want you to see what I'm dealing with. And that's great. But there are a lot of folks in our community that do not live in a major metropolitan market. And so for folks that are an hour outside of the city, sometimes 2 hours outside of a city, and they are in a suburban or rural area, we want to make sure that they are not limited to virtual care as their only option. And that means having people that are willing to get in the car and drive to see you at your home. It seems a little old-fashioned maybe for, a modern healthcare system that we boast having in the United States. But in fact, as it relates to maternal and infant health, it is sometimes the most effective way to provide support to a family.
Speaking about lactation consultants and doulas, I'm curious because we certainly know that for some of them that we know, they're very anti a lot of these virtual only, tech enabled companies, because they're actually not able to compensate them in the way that they need. And so maybe you can talk about that and how Mahmee views it. Because I know that is not the case. And so
There's misconceptions.
Yeah, misconceptions, and to understand, how Mahmee differentiates itself there.
Alongside the proliferation of AI-driven solutions that are not necessarily built on robust data sets in maternal infant health, I'd say that my second greatest concern in this field is around the proliferation of the marketplace model in maternal infant health. And as you referenced, Rachel, there are solutions that don't necessarily compensate appropriately or accordingly for this care and still put a lot of the onus, a lot of the burden on the patient to find a provider through these directories, registries, networks, marketplaces. And Mahmee stands apart from that market, specifically because we have an employed workforce. We are more of a mini healthcare system. All of the providers that are working with us are employed and are working with us in a team-based capacity. We have a rigorous hiring process. It's extremely difficult to get a job at Mahmee. We've got wait lists in every category for care. Providers hear about us and they say, wow, this sounds like a really great experience for someone who is, for example, coming up in a career and wanting to get into the field of maternal and child health and see a lot of patients very quickly. And we certainly have volume, which helps people to get trained up faster and get better at their jobs. But we also have to be very mindful that we don't want to match a patient with a rookie provider. And so there's a lot of people that want to get jobs at Mahmee. We are very selective about finding folks that have many years, in many cases, decades of experience doing this work, have really seen it all in their realms and want to bring that knowledge to bear and bring those skills to bear in a way that supports a lot of families through the use of technology. So those are some of the things that we really try and focus on. And in having a team-based model, one thing that differentiates us is that when a patient actually signs up for Mahmee, they're matched with a care team right away that meets their story, their needs, and sort of like we're filling the bench right from day one. You don't have to, sort of raise your hand and say, oh, I need this now, I need that. We're preparing the team to work with you across that episode. You may not need mental health support right now, but based on your medical profile, based on the things that you have as part of your care plan, your personal goals, we're kind of queued up and ready to go if that's going to be a service that you need. That's one of the differences. In a lot of other cases, patients are left to search on their own when they determine that they need mental health support. And in many cases, unfortunately, that's when they're already in crisis.
So collaboration in healthcare is key. How has Mahmee partnered with insurance providers, healthcare providers, and hospitals to ensure that the platform reaches as many people as possible and is really democratizing that care?
Well, most of our patients actually are getting Mahmee covered through one of our enterprise partnerships. So some or all of their care is already being paid for through a larger organization. That might be a large insurance company, a health system, or a hospital. We have partnerships with medical groups. In some cases, doctors say, I love this so much, I want to make sure every patient has this. And they actually work it into their costs for you to be with their practice so that you have Mahmee as part of that care experience. And so in all of these cases, the foundation of this is a partnership directly with an enterprise organization that has made a commitment to equitable access to maternal and infant health care. So we like to work with organizations that have that at the forefront of their minds, that are trying to find ways to equitably distribute this care, basically make it easy, hit a switch, and make this available to everyone who needs it. We then are able to create what we call value-based pricing models for these organizations based on the size of their population, how many patients or members they have in a given population, what the risk profile of that population is. We do a lot of data analysis with these organizations. It's a very involved partnership to scope these deals and to design them in a way that meets the needs of a specific population. And then from there, we're able to say, okay, so-and-so enterprise, if you pay for this for all of your new and expecting families in your population to have access to it, you're going to get a really great price break on it that makes it very cost effective to make it available to everyone versus what it would cost if you paid as you went every time someone signs up, or if you put that burden on the families to pay for on their own. And through that, we're making it possible to have comprehensive maternal health care available to broad portions of the population at the best pricing in the market. So we work with a number of different hospitals. One example is a partnership that we have with Providence St. John's Health Center in Los Angeles, and it's a leading medical facility. They've got a really extensive obstetric labor and delivery program, and they came to us and said, we want to enhance our lactation program. We want to make sure that every patient who has a baby at this hospital also gets comprehensive lactation support at the bedside in the hospital and also when they go home. And first of all, what an amazing thing for a hospital to commit to and say, we want to go further than other organizations are going to ensure access to care. And we designed a program for them that actually stations Mahmee employees at the hospital. So we sort of took over the lactation department, and we have our staff there. We're in our team scrubs. We've got the Mahmee app, sort of set up there for families to sign up to get access, and they're able to get lactation support right there in their beds in the postpartum recovery unit right after they have their babies from Mahmee staff. But what's really powerful is what the hospital committed to when those patients leave. So, a day or two later, typically they're discharged from the hospital. They're wheeled out the door, just like Rachel was saying. You're wheeled out the door with your new baby. And in many places in the United States, you're told, good luck. Call us if you need something, or don't call us, call your doctor. That's oftentimes the message from the hospitals. The hospitals that we partner with are taking a different tack. They're saying, we do want you to have support. We want you to know that we're there for you. And we've partnered with Mahmee to make sure that that's possible. And so every patient that leaves that hospital from the OB unit, regardless of what their care experience was, regardless of whether they delivered prematurely, they had a C-section, they delivered at term with a vaginal birth, they're there with their surrogate, whatever the story is, they're getting a Mahmee membership to have access to the care team that worked with them, and not just the lactation consultants, but the rest of the model as well. So a lot of the patients that we're seeing in the hospital for lactation support end up going home and then saying, I want to talk to a doula now, or I'd like to talk to a nutritionist and figure out what am I allowed to eat after I have my baby, and how do I start to feel like myself again and get my body back. And all of these services are available to them through the hospital.
Something I'm really proud of with Mahmee is that you are not a concierge service for the rich. I think a real value of ours at Muse Capital is democratizing access to care. And I think that the fact that you've been able to partner with healthcare systems that don't just cater to that audience, but to the Medicaid, Medi-Cal population is just something to be very proud of, and something that we see as very, very different to other, technology, maternal healthcare companies that are coming out today. And so maybe you can talk to that.
I think that a lot of companies are talking about how to get their products covered by insurance. I can tell you, hands down, it's been a long time coming for us. It's been something I've worked at for years. It's the place where I am most frequently putting on my law degree hat and thinking about, how do I get these deals done? How do I contract with organizations that are notoriously difficult to contract with? It starts by making the business case for this kind of care and for this kind of care to be delivered in this kind of way. I was met with silence, with crickets for years building Mahmee, presenting this work, presenting the vision for this work to health system executives, to hospital executives, to clinical leaders that have said for a long time and really sort of bang their fists, we need solutions in this space. And then I sort of present Mahmee and I get some version of yeah, no, that sounds great, but is that really viable? Is that scalable? It sounds, in some cases, people have said, and it's such an interesting challenge in maternal infant health because it actually is. The industry overall is struggling still from a dearth of innovation. And so you see these extremes. I've been in rooms where people have said, I don't know, it's very service oriented. It's if it was just an app or a chatbot, then maybe that's what we need. Because healthcare at times can get really reductionist and just say well, we just need more software. We just need more apps. I don't know a patient out there who's just what, if I just had more apps, that's what I'm looking for. That will help me be well if I just had more apps. But it's amazing how many rooms I'd gone into over the years where I pitched the vision of Mahmee as this hybrid care company, as a comprehensive model. And people are but could we just have an app with chat features and some articles in it and stuff like that? And I'm like, I don't think that's really what your moms are looking for. On the other side, I also was met with a lot of questions around it not being, well, some folks are like, it's not techie enough. And in other cases, it's like not servicey enough, as in like it's too much tech. I've had other leaders of organizations say, no, we don't want any tech. We just want in-person clinic, in-home care. Can you just do that? Don't make our patients sign up for your app. We don't want that. We don't want any video or virtual care, just the in-person part. And I, in those rooms, tried to explain that's not enough for families either. You're not going to reach everyone if you are strictly an in-person model. But because that's so much of what healthcare was built on, you do see these extremes where some people are like, no, that's what works. We got to keep with that. And in other cases, people say, no, we have to go the other way entirely. It should be strictly virtual. It should be strictly technology driven. The blend has been a hard thing to sell for a long time because there are questions about whether or not that is a scalable, venture backable solution. 10 years on, with deals with some of the leading healthcare insurance companies in the country, leading health systems, billion-dollar health systems that are in many cases delivering anywhere between, say, 0.5% and 1% of an entire population of the birthing census. I mean, there's that may not sound like a lot, but at nearly 4 million babies born a year in the United States, for any one organization to be delivering, let's say, 1%, 40,000 births, that's a very big system. The fact that Mahmee has served over 40,000 births is a testament to what we're capable of as an organization and how we've grown ourselves into a business that can play with those kinds of heavyweight organizations.
So what is your wish and vision and mission for Mahmee?
Well, it's pretty straightforward. Mahmee's mission is to make the U.S. the best place in the world to give birth. Our vision is equitable access to comprehensive maternal and infant health care. Achieving that mission and vision is not possible unless you use the lens of health equity and you center the margins and you listen to the folks that have not been listened to, have not been heard, and have not been fully supported, and solve for their needs. If you do that, you actually can make this a much better experience for all.
And if you could leave us all, future mothers out there or women who are about to give birth or have just given birth, with one piece of advice on their healthcare journey, what would it be?
Nobody knows your body or your baby better than you. It's imperative to speak up and to ensure that people are listening and taking care of you, and to not accept being dismissed or cast aside. If you feel that happening, you got to speak up again and find someone who will listen. And in some cases, it's not necessarily about finding someone who will listen. Maybe you have people around here listening, but it's about finding someone who will speak to you in a way that is respectful, is understanding, is compassionate, and will actually help you solve the problem in a way that you can receive. In either case, it's about making sure that you do advocate for yourself and you find people who are willing to walk that path with you.
That's a wonderful way to leave us, and also to urge people to join Mahmee. And the way they can do that is by going to the website, which is
www.mahmee.com. And Mahmee is spelled Mahmee.com.
Mahmee.
Yes.
And one of the other things that I find very cool is that you can also learn more by just picking up the phone and calling them at 818-431-1118. Of course, all of these details will be in the show notes.
And yeah, thank you so much, Melissa, for being here, for sharing your story, and for all the incredible work that you are doing that now both of us have personally experienced and has made, a huge difference to us and to our families. And so we couldn't be more thrilled to be part of your journey.
We love you.
Thank you. Thank you so much for giving me this opportunity to share with you. But more than anything, thank you for believing in the vision of Mahmee from so long ago and really staying with us and helping us to evolve into what we are today. It's the ultimate, having investors by your side who understand what it is you're trying to bring to life, because for me, it's everything. Being a founder and knowing that there are people that are willing to go to bat for you and cheer you on, and also be there to support when the road gets tough, because it does. It's inevitable to face those no's and face those challenges. I'm so glad to be building Mahmee 10 years on and to be doing it with both of you.
Oh,
We're proud of
thank
you.
you.
Thank you.
Super proud and so excited for what's to come.
Thank you so much for listening. For additional information, check out our show notes, and to find out more about Mahmee, go to mahmee.com or call 818-431-1118. As always, you can find out more about us at musecapital.vc. And speaking of motherhood, in our next episode, we'll be speaking to Dr. Sarah Orrick and Emma Sugarman, the founders of Mavita, a digital mental health platform that provides support for women and families going through the reproductive journey. Whether you're struggling with fertility, postpartum depression, or in need of couples therapy, tune in to find out more. Special thanks to our executive producer, Lauren Maddock, and our engineer and composer, John Meek. Ciao for now.